methods are usually the most boring section to read.
Yeah, we all skip that section.
Yeah, but they're very important, and they're also the most boring section to write.
Welcome back to the Exam Room Nutrition Podcast, your guide to giving better nutrition advice. I'm your host, Carlene Starck. I'm a PA and dietitian, and today's episode is for those of us who aren't trained researchers and maybe get tripped up remembering the difference between a randomized controlled trial and a prospective cohort study. And yes, I'm also talking to those of us who skim the abstract, just scroll right past the methods and results and head straight for the discussion. Like, just tell me what this means. I'm guilty of that too. Because here's the problem. Social media is overflowing with cherry-picked studies, misquoted headlines, and bold claims that sound convincing, but can actually cause harm when they make their way into patient care. And we have to know how to analyze these studies. So in this episode, we're breaking down the hierarchy of evidence, what research sits at the top, and why not all studies are created equal. Plus, I'm doing something I've never done before. We're actually going to unpack a real paper together. And more importantly, we're going to learn how to tell if a paper is actually high quality or dressed up to look that way. To help me do this, we're going to pick the brains of Dr. Carlene Starck. She's a protein biochemist and a nutrition scientist with over 15 years of research experience. Now, you maybe won't have a PhD by the end of this episode, but you will walk away with a better framework for analyzing research, more confidence opening the methods section, and a sharper instinct when bold claims start circulating online. All right, so get comfy or drive safe and enjoy my conversation with Dr. Starck. Carlene, I am so excited for this conversation. As I was preparing the questions to you, I was just getting more and more excited to actually unpack this topic with you. So thank you so much for letting me pick your brain today. Welcome to the show.
Thank you. Honestly, it's such a pleasure to be here.
All right. Well, we've got a lot to unpack today, but I want to start with the basics. So when people say that it's good research or this is a quality paper, what do we actually mean?
So this is quite a loaded question in that there's lots of different ways to look at quality. So when people are talking about study quality in the research, what they're usually talking about are the hierarchies of evidence. And there are a lot of different ways that this has been laid out. But the hierarchies of evidence are really talking about study design. So the type of methods that are used to undertake the study. And if we think about study design, there's kind of two broad categories. One is interventional research, one is observational research. I'll try not to go into too much detail, but our interventional research, that's something like our randomized controlled trial, or our RCT. Sometimes it's referred to as a clinical trial, but a clinical trial doesn't automatically mean it's an RCT. So that's just a little heads up. But in an interventional study, in a really strict randomized controlled trial, it's probably considered as the highest quality study design because it's very tight control. We're able to go in and look at the effect of a specific intervention on a specific outcome. It's important to keep in mind that when I'm talking about this, just because something might be a randomized control trial, that doesn't automatically mean it's high quality. And so we have additional tools that we can use to go in and assess the quality of a study. And one of the things that we assess a lot is called risk of bias. So that's how likely it is that the results are going to be biased towards a specific outcome. And that takes a lot more time than just sort of reading the paper, obviously. The other type of study is our observational study. So this is the hint is in the word, it's observational. What we're not treating a population in a specific way with a specific intervention, but we're taking a step back and we're observing that population and we're taking measurements of that population without necessarily manipulating them in any way. And in the observational studies, what would be considered the highest quality observational study would be our prospective cohort study. So this is when you have a cohort of people. Usually we've selected them for a specific reason. So they're similar in some kind of way, like it might be older adults or it might be pregnant women or something like that. And then we are following them over time for a set amount of time. So we're not controlling them. And the benefits of an observational study are that we can usually follow them for a much longer time, 20, 30 years if we want to, whereas a randomized control trial is shorter. So they have their pros and cons, but in general, randomized control trial would be considered the highest quality, and then you have your observational studies. So those are kind of the study designs. But if we're thinking about the hierarchy of evidence, what would be considered as being the highest level study design would be our systematic literature review. So what this is a review of an entire body of evidence of a specific type that's conducted in order to answer a specific question. And that systematic literature review will have very strict eligibility criteria, and we might want to, for example, only look at randomized controlled trials or only look at prospective cohort studies. And so the type of study that's in that systematic literature review is going to define the quality of the systematic literature review as well. One of the tools that's used very routinely now is called GRADE, which is a tool that is used to sort of give us an idea of how confident we can be that the outcome is a real outcome. So a grade rating of A would say we've got really high certainty that the effect that we're seeing, so maybe of fibre on cholesterol, is a real effect. But in general, it's considered to be high quality because we're looking at the entire body of evidence. And we're also conducting that systematic literature review in a very strict, structured kind of way. It's got an established methodology that we need to follow. There's guidelines. Everything is done very routinely. And that's done in order to make sure that we are able to pull the highest quality evidence, or we should be trying to pull the highest quality evidence in order to answer a specific question. Sometimes in a systematic literature review, you might also have a meta-analysis, which is where you've got the same body of evidence or maybe a reduced body of evidence, but we're able to look at that quantitatively. So we're able to put numbers to the conclusions that we make. So levels of evidence, systematic literature review, with or without meta-analysis, will be at the top. And then you've got your randomized controlled trial prospective cohort study. There are other study designs, obviously. So you could have an intervention trial that's not controlled very well, or that's maybe not randomized very well. So that'll have lower quality. You can have other observational studies that maybe it's a cross-sectional study, so it's just one snapshot in time. So that's going to be lower quality. But in general, when we're thinking about high quality, most people are talking about a randomized controlled trial or, above that, a systematic literature review. I'll just point out too that, of course, the other thing that's going to come into this is whether or not the study was conducted in humans. And everything I've talked about today so far has been human studies, but we also have animal studies. And then you also have studies in humans that you would class as being mechanistic studies. So these can be very, very high quality studies, but they're not included in those levels of evidence because they don't follow a strict study design. So I hope all that makes sense.
So most of my audience are like PAs, dietitians. Not many have PhDs. And this is exactly why I wanted to bring a researcher on, because unpacking and understanding what makes a quality paper is obviously very, very complicated. And people on social media make it seem easy, right? They just will be like, oh, well, this study and this study. And without really digging into it, you can easily be misinformed on actually if that outcome is from a high quality paper. So I think that overview was super helpful. But Carlene, I wanted to find out, why is it important for us to look beyond the abstract and then consider details like the study design and then the sample size? Like, how much does that matter? And how much information can we actually get from an abstract?
The abstract is generally where we go to first, right? If we want to even look further into the paper, we're going to read the abstract. And every single researcher out there will do that. But a really important point in the abstract is that we have a specific word limit that we have to fit into that abstract when we publish a paper, which means that there's no way that you can include every single important piece of information. So it's not going to tell you everything that you need to know. A good abstract will provide the most important information, but it's not going to provide specifics about the methods. It's not going to go into detail about maybe some other results that were included, but they weren't the main results that may change our conclusions. And also, I have come across studies where the conclusions made by the authors in the abstract are actually not a fair reflection of the results of the paper. And so it's just really important to use the abstract as a guideline to see, do I want to read this paper further? What are the main things I need to go in and find out from the paper? But then also go in and have a look at the methods. And the methods are usually the most boring section to read.
It's
and
the section we all skip that section.
Yeah, but they're very important, and they're also the most boring section to write. But they can give you a lot of information about how good that study is.
How important is sample size?
It's very important, but again, it depends on the type of study. So you can have a small sample size that actually provides a good result, and you can have a large sample size that still can't provide any clear conclusion. So again, going into the study and having a look at the methods is important. But what a sample size does, especially in, say, a randomized control trial, but also in observational studies, the way that we develop a sample size is we have a calculation that we use to make sure that our sample size is adequate to actually be able to provide a meaningful answer to what we're trying to assess. So if the sample size is too small, if it's not adequately powered, we would say, then the conclusions that you make, we can't be very confident around. So it is important, but it's sort of it's one of those things you need to go on and read the methods to sort of go on and look more.
All right. So a lot of research is coming up now in the social media world. Influencers are often quoting like a single article, and they can make it sound very convincing to match their narrative or maybe sell a supplement that they're supporting. So what would be the best way for clinicians to maybe quickly assess if that paper that they're referring to is actually something that we can use to, change our guidelines or to change our education for patients?
So I'm going to give the hard answer, which is the only way to really assess whether or not we should pay attention to that paper is by assessing the entire body of evidence, which that's not a quick answer. We really need to look at it, because you could have years and years and years of evidence, really strong, and then this new paper comes out and it says something completely different. And yes, that's interesting and maybe exciting, and maybe influencers have blown it up to be something really quite provocative. But actually, if we compare it back to the body of evidence, it doesn't stand very strong, or maybe it suggests that we just need further research. But I think if we want to have a really quick assessment, first question, was it conducted in humans? If it's conducted in animals and they're making a big deal out of it, there's only a certain amount that you can say. And it would be considered to be emerging, maybe it's interesting, but there's nothing we can say until we really look in humans. Second question, what was the study design? Was it a randomized controlled trial or an observational study? If it's a randomized controlled trial and it's done well, that means that we can actually create conclusions around whether or not the intervention caused the outcome. So it will be a causal association, because in our randomized controlled trial, we're specifically targeting that intervention. If it's an observational study, we can't get any information about cause. All we can say is that there's an association, because in an observational study, you're not controlling every single factor that could also be involved in producing that outcome. So all we can say is we've taken these measurements, these two things are occurring at the same time, it looks like they're associated, but there's no cause necessarily. So those are probably the big ticket items to go on and have a look.
How important is gender representation? So there was one study that I was looking at, and it was like done on all men, but their conclusion was, extrapolated to like a population wide. So I'm curious your thoughts on gender specific results.
Yeah, that's a really good point. One of the things that we talk about a lot with studies is generalizability. So if we look at the population that was studied, can we generalize that to the wider population? And you're right. If a study was only conducted on men, we can't take those specific findings and say that they're going to apply to every single person. Also age. So if you've got young males, can you apply that to older males? You might be able to go in and rationalize it by looking at biochemical pathways, but you can't automatically say that this is definitely going to occur in older males unless the evidence is there. So males to females, that's a big one. We know that our hormones are different, so it's definitely something to be mindful of.
Let's talk about funding. Because anytime you bring up a study, people will always be like, oh, but look at who funded it. And they have a major problem when there is food industry funding. And it almost always warrants some skepticism. And so I would love to find out from you, like, why are people skeptical of food industry funded studies and what your opinion is on the outcomes that we get from that research?
People will automatically sort of think that because industry has funded the study, that means that they have this vested interest and they're going to manipulate the results in some way, or maybe the study is going to be conducted in a way that's designed so that you only see the positive results, so you only get one outcome, or maybe we don't publish everything. There's a lot of strict policies that are put in place to make sure that those things don't happen. And when you work with some bigger industries, there's a lot of conversations around who's going to be in charge of the study design, who's going to be in charge of the assessment and the analysis. And most of the time, the food industry does not play any role at all in study design, assessment, writing it up, anything. But some of that skepticism that exists is warranted. So there are instances where the food industry has played a role in maybe some less trustworthy results. Most of that is old, but the thing is we shouldn't be assessing a study based on who funded it, because that's only one part of the equation. The real crux of whether or not a study is high quality and whether we could trust it is the methodology, is the study design. What is the research question? Do the methods answer that research question, and are the conclusions made by the researchers in line with what the findings are actually showing? So those are the things we need to answer. And really, at the end of the day, that's the responsibility of the researchers who are doing the research to make sure that the integrity is maintained, even if they're working with industry. And it's also up to the journal who's publishing the article to make sure that they're taking every means possible to rigorously assess the methodology. And that's why we have our peer review process. So there's a lot of things involved. I will also mention that sometimes food industry funded studies are much more rigorous and robust than government funded studies because they know that they're going to be subject to that stringency. So, I think it can go either way. So you have to look at it objectively.
Yeah, it complicates things. I actually did a podcast episode on seed oils, which is, a very hot topic, and you get a lot of opinions, even amongst healthcare professionals about seed oils. And I used a lot of resources from US soy, and I got a lot of comments that I shouldn't have been using those articles to support, the facts about seed oils. So I'm curious, how would you respond to someone who says that, the studies you're citing do have bias because it's funded by big food?
Mm. An important point to make is that there's a lot of studies that wouldn't exist if we didn't have the food industry funding. So, and especially when it comes to diets and food, because a lot of the funding that we have is really focused around disease and chronic disease. And when it comes to looking at the effects of food on sort of health and supporting health, there's not as much money there. So we have to include those studies. I think that the key is if we're including food industry funded studies, we have to make sure that we look at them in the same way that we look at other studies. We might want to disclose the fact that they were funded by industry. Yes, this study was funded by the soy industry, but there was a specific statement made that the soy industry didn't play any role in the study design. All of that information should be in at the end of the paper. So there should be a statement about conflicts of interest and funding, and we should be able to take that on board and use that. So if a study is funded by industry and there's nothing written about the role of industry in that study, that's when we might want to be a little bit more cautious.
Yeah. There needs to be disclosures regarding that.
Yeah.
Now, you mentioned something interesting that without industry-funded research, we would have very little research because there just isn't enough government funding for nutrition research. And so I'd love to hear, just in your opinion, what are some important, maybe landmark studies that have only been made possible because of industry support?
Yeah, so there's quite a lot. In terms of the stuff which I've been more involved with, there's been a lot of really good research funded by avocados or the Hass Avocado Board, looking at the effects of avocado on LDL cholesterol. So that's really important because it highlights the fact that avocados can play an important role in our diet and in supporting cardiovascular health. I've done a lot of research with Zespri, who are the kiwi fruit company. So they're here in New Zealand, but they're also worldwide. And a lot of the Zespri research has played a really important role in supporting digestive health, especially in older adults and in hospitalized people. And so there's been a product which has been made by Zespri, it's called Kiwi Crush, and it's now used in hospitals to support people coming out of surgery with constipation. So if all of that funding hadn't occurred, then that product wouldn't have been able to make it to hospitals and be used routinely to support those outcomes. One of the areas that you mentioned that I'm really interested in is protein research, and there's been a lot of really important dietary protein research which has been funded by the food industry, companies like the National Cattlemen's Beef Association and the Pork Board. So a lot of that has gone into supporting that research, which is difficult to get funded outside of food industry research. And of course, that's really important when we think about preventing sarcopenia in older adults and understanding the role of muscle mass in actually supporting healthy aging. So there's lots of different instances, both in the animal protein and in the fruit and vegetable zone.
I love this conversation, and I think we shouldn't fear food industry funded studies, but like you said, look at it, look at the evidence in total, make sure that there's that disclosure statement at the end, but they are very impactful and beneficial and in shaping our guidelines and shaping how we educate our patients moving forward. Okay, Carlene, you unloaded a lot on us, but I want to get really, really practical. So let's unpack a real paper together. And so I'm going to pull up a paper that I want to kind of pick your brain and see how you would analyze this and determine if it's a quality paper. Okay, so I chose this paper to unpack because this actually became quite popular on social media by an influencer who claimed that a folic acid supplementation is causing autism in children. And so it was quite outlandish, like a wild claim, but he cited this paper. And so I wanted to pull it up and have you give us, what do we look at when we hear a really wild claim like that we're like, oh my gosh, it's jarring, it's shocking. It makes us question what we know and what we've learned and what we're telling patients. And so walk me through, what are some steps that a clinician can do when they do decide to pull up a paper? What should we look at?
Yeah, so just to sort of provide a little bit more background on this as well, I think it's important to say that there are actually a lot of influencers talking about folic acid supplementation and advising people not to use folic acid supplementation, which concerns me quite a bit and is actually quite dangerous because, as I mentioned, we need to think about things in terms of the whole body of evidence. So if we're going into this paper and we're having a look at it, it's important to have an understanding, if we're really going to critically assess it, on the body of evidence that does exist in terms of folic acid and the risk of neural tube defects in children, because that is why the folic acid fortification and folic acid supplementation recommendations are made. And we do know that there's a huge amount of evidence that supports folic acid supplementation, both pre-pregnancy and early in pregnancy, on a very dramatic reduction in the prevalence of neural tube defects in babies and in children. There was actually a 2025, so this year, an umbrella review was published. So an umbrella review is something which is like a review of reviews. So it's a review of all of the systematic literature reviews. And if we have an umbrella review, we know that there's been a heap of evidence that have been published on an area. And that umbrella review did, again, highlight the fact that I think it was like a 50 or 60% reduction in the prevalence of neural tube defects. So it's just important to go into this paper with that in mind. We know that there are benefits. So if I'm looking at this paper, the first thing I'm going to look at is the title. The title says, a prospective birth cohort study on cord blood folate subtypes and risk of autism spectrum disorder, or ASD. So first thing I notice, it's a prospective birth cohort study. That's an observational study. That tells me that I'm not going to be able to get any kind of causal information. I'm not going to be able to say, or the authors are not going to be able to say that there is any kind of cause of cord blood folate subtypes on ASD. The other thing that's important is that we're looking at cord blood folate subtypes, right? We're not looking at folate supplementation. We're not looking at folic acid supplementation. We're looking at the specific measurement of folate and different types of folate, and they're using that as a proxy for intake. I do know in this paper they did have a look at the relationship between the different between cord blood folate and intake, but it's important to just note that we're not looking at supplementation per se. So that's the first thing, and that kind of tells me, okay, I need to hold a little bit of reservation about what's actually going to be made. It doesn't mean the paper's not good. It just means that these are the sort of the constraints that I'm going to look at this paper at. Then I'm going to look at the abstract, and I'm just going to run through the abstract. And again, we mentioned you can't take everything from the abstract, but I'm going to skim the background, objectives, methods, results, and conclusions. If I look at the background, I find a really interesting sentence that they say, we previously reported that extremely high concentrations of maternal plasma folate were associated with increased risk of ASD in children. That is interesting to me, and that tells me I really want to look at the introduction more to understand where they're coming from, because that sounds like a pretty big statement to make, and I want to know how much evidence there actually is behind that statement. If we skim down further, the objectives are pretty straightforward. We're looking at these different types of metabolites within the cord blood. They say we also examined prenatal correlates of cord UMFA concentrations. What is UMFA? That's unmetabolized folic acid. So we know that we need to have some kind of understanding of what unmetabolized folic acid is, which again is in the introduction. We look at the methods. This report included 567 BBC children, 92 had ASD and 475 had been neurotypical. Now, this is another red flag to me, because if we look at those numbers, they're really quite high. So I think that's around a 15% prevalence of ASD in this population. And we know that the prevalence of ASD in the general population is much lower. It's less than 1%. So again, that's saying to me, okay, this is maybe a cohort that maybe the prevalence of ASD is overrepresented. And then we look at the results. We can see they've sort of put out the results there. There's some quite interesting numbers that stand out to me. So the first sentence is that children with cord UMFA, so unmetabolized folic acid, in the highest versus the lowest quartile, so that's people with the very highest levels versus people with the very lowest levels, had a greater risk for autism. Okay, that's cool. That's awesome. I can see that. The OR, which is like a ratio that tells us it's an odds ratio, so it sort of tells us what that increased risk would be, is really high. That's 2.26, so that's like 126% increased risk. It sounds really dramatic, but if we look at the 95% confidence interval, it's a very wide confidence interval. So again, that's telling me that the data may not be as good as what it could be. And then the next sentence is probably the most important sentence in the entire abstract, which is, when stratified by race or ethnicity, the association was limited to Black children. So again, this is saying all together to me, is that we've probably got a cohort which is overrepresented in ASD, and the findings are limited to Black children. So if we go back to what we were talking about in terms of generalizability, we know that the findings are probably not going to be generalizable to the whole population. But I've pulled out some important information that really makes me want to go on and look more at the introduction, more at the methods, more at the results. I need to get more detail. I think also in the conclusions paragraph, the authors are very, very good in that they say, this study is a preterm birth enriched cohort, and it raises more questions than it could answer. So that's important. And if people are taking this study to be this gold standard answer to the relationship between folic acid supplementation and ASD, it's showing in those conclusions that it's just not doing that. The other thing in there is that the study is a preterm birth enriched cohort. So I would have liked to have seen that information provided earlier in the abstract so that I know what I'm looking at. However, as we mentioned, there are word limits, so the authors were probably trying to fit everything in. But when I mentioned that it seems like, according to the numbers, it might be overrepresented in ASD and the prevalence of ASD, we know that preterm birth is a risk factor for ASD. So what we've got is this subtype or the subgroup of the sub-cohort, I guess, of the entire population where ASD is overrepresented, and we're only seeing findings in Black children. So the generalizability of these outcomes, even if they are true to the total population, it's not there. So immediately, if I was just looking at the claims that have been made by influencers and then looking at this paper, I'm going to say, I don't think those claims really hold up. And I've looked into some of the claims and they used words like folic acid leads to negative health outcomes. That's a causal statement. That's not an associative statement. So, but when we look at the methods and we look at the results, it's just sort of substantiating the caution that I held when I looked at the abstract. That if we look at the results, there's really large confidence intervals. So this is a table that's showing the association between lots and lots and lots of different outcomes. So they're looking at the total sample up the top, and then they go down. You can see on the left-hand side, UMFA in blacks, UMFA in non-blacks, UMFA in PTB, which is, I think, is preterm birth. So they look at all these different subgroups of the entire population. And if we go across to model 3, so they used a lot of different models. And what these models are is we're effectively adding, we're continually adjusting for all of the different confounding factors that might be also involved in producing these outcomes. Model 3 is the most stringent. And you can see that in the total sample up the top for model 3, the P trend, which is the level of significance that's been attributed to these numbers, is 0.05. This is what we would call marginally significant at best. So it's really dodgy. We can't really say there's something really solid there.
I'm so glad that you unpacked this table, because when I look at something like this, I'm like, okay, yeah, keep scrolling. Like, this is a lot of numbers and acronyms, and it's very overwhelming to a non-trained eye, which is probably my point is people take what, an influencer with maybe some credentials, they take what he says at face value because they don't have the knowledge or the ability to really unpack the details in the study. And so I think this is why having this conversation is really important.
Yeah, I agree. I mean, you look at even just looking at all those footnotes in the table, like there's
Yes.
a number. And if you don't know anything about statistics, that table is going to mean absolutely nothing.
Now, every paper has to have disclosures. Is that important to pay attention to in this paper?
Yeah, it is. I mean, so they don't really say anything about funding from what I can tell. What can be important to have a look at is the responsibilities for each of the authors in the paper, just to make sure that, if you've got the same author who's conducting the study and analysing the results, and especially in a randomized control trial where we want to maintain an anonymity as much as possible, that can create bias. So making sure that we're not necessarily adding our own bias into interpretation of the results. It can be really important to have somebody analysing the results who is different to the person that actually conducted the study. Probably not such a big deal in this study because it's a cohort study, but can still play an important role.
One final question about analyzing papers. How important is the published date? More specifically, like, what would be your range to where you would say, oh, this is too old, even if it's a great paper, like this is too old to use in current day education?
No range at all. So there are some really, really, really amazing old papers that have been published. I mean, I've used papers that are like 1950s, 1960s, because the data they present is really, really good. Obviously, it's not as high tech, but what's more important is, as I mentioned, the body of evidence. So what has been published since that time? Have we had an updated understanding? So I would always look at that. So if I'm trying to understand the most recent information about a topic, what I'm going to do is I'm going to search first for umbrella reviews, because that's going to tell me the most. I'm going to look for the most recent, highest quality information on the topic, and that should give me a really good understanding.
That was such a fun exercise. Thank you so much for unpacking that. I know if you're listening and you have a PhD, I know we barely scratched the surface of analyzing papers, but for us who are just trying to stay ahead of things and give our patients good advice when we do come across papers or even influencers online making these outlandish claims, it's really important to know how to analyze all this literature that's coming out. So Carlene, thank you so much for going through that with me.
You're very welcome. And yes, I could have taken a much deeper dive, but again, like as you mentioned, we're looking at things quickly. So you have to be able to sort of pull out those key pieces of information.
So if people want to connect with you or learn more about you, where can they find you online?
So probably the best place is LinkedIn. That's where I spend most of my time, possibly too much time. And that's my LinkedIn handle is Dr. Carlene Starck. Starck is spelled with a C, so Starck. That's where a lot of people trip up. I also have a website, which is Starck Science, so starckscience.com. And if you jump onto that website, I do have a newsletter that you can sign up to. You get a free PDF about protein and how to sort of start to understand what a good protein intake is. So those are probably the best places.
Thank you so much for the gift of your time and helping me understand how to do this research and analysis.
Thank you so much.